All right, well, good morning, everybody. I'm Dan Polsky from the Bloomberg School of Public Health at Johns Hopkins University. Welcome to this workshop. The title of our workshop, Investing in Interventions that Address Non-Medical Health-Related Social Needs. When I tried to get past security, I said, what workshop are you attending? And we've been planning it for 2 months, and I'm like, it has something to do with social needs. I could not remember the name of this workshop. It's a little wordy, but I think for those of you who are here in attendance, welcome. I think the title must have grabbed you, so thank you all for being here, and welcome to all those who are attending by webcast. It's really a pleasure to have such a robust audience here today. I get the honor of being up here as the Planning Committee Chair. And so it has been a whirlwind of a couple months with this terrific Planning Committee, which you will see throughout the day shortly, planning this event, which has been here at the National Academies of Sciences, Engineering, and Medicine. The workshop is being conducted at the request of the Office of the Assistant Secretary of Health at DHHS. And our statement of task, I'm going to read this to you verbatim because we want to stick to our task today. Number 1, explore effective practices and supporting evidence-based to address non-medical health-related social needs. Number 2, review assessment of the return on investment. ROI, we'll just be saying ROI most of the day. Most of you are very familiar with that term, but I just thought I would state it as return on investment, our first time here today. So we want to assess the assessment on ROI for payers, health systems, and communities. And number 3, we want to surface gaps and opportunities for research and steps that could help further the understanding of the ROI on addressing non-medical health-related social needs. So keep these tasks in mind throughout the day. The agenda that we organized is designed to achieve this objective. We'll start by setting the stage for having this conversation by considering different perspectives on addressing unmet social needs and also community-level social determinants and assessing value to health systems, payers, and communities. We will then focus on a number of interventions. We'll talk about housing, food insecurity, and interventions that address multiple social needs. We'll then delve more deeply on exploring ROI from different perspectives, and we'll end the day with a discussion on the research gaps and next steps that might help DHHS and the many change agents in this room and on our webcast further the understanding of how best to develop, sustain, and scale valuable interventions addressing non-medical, health-related social needs. So I want to emphasize that this is a workshop and not a series of lectures. We don't expect our panelists to have all the answers. We invited experts who can bring their perspective to a conversation aimed at looking forward. What are the research priorities to advance gaps in understanding? What types of policies should be advanced now to promote sustainability of effective strategies? Thus, the sessions are organized to learn about the perspective of each panelist and then to promote conversation. So each session will have 3 parts. The first part, brief speaker presentations and introductions. The second part will be a moderated discussion, and the third part will open it up to the audience to ask questions. We'll also take questions from our webcast if time allows. So it's really, we want everyone to get involved here today. So as part of the planning committee with the Academy's staff, I'm very grateful to the following planning committee members who devoted their time to develop this workshop: John Arbach, Seth Berkowitz, Dave Chotchke, Karen DeSalvo, and Maurice Jones, who you'll see today participating in the sessions, along with Arvind Garg and Deidre Cruz, who are unable to be here today, but were tremendous. Just everybody worked so hard in the past 2 months to put this together. I just want to thank you all for your devotion to putting this together. I also want to thank today's speakers for taking the time to join us and sharing their expertise and experiences. Speaker bios can be found in your packet you received this morning. Please refer to the bios throughout the day. Just so we can optimize the time during the presentations, we will not be reading bios when we introduce all our distinguished panelists. And we will put together proceedings of this workshop, and all participating will be notified when this publication is ready. And if you're on Twitter, don't hesitate to tweet. Please use the hashtag #SocialNeeds. Now I have the great honor of introducing our keynote speaker. Admiral Brett Giroir is the 16th U.S. Assistant Secretary of Health in the Department of Health and Human Services. He serves as the Secretary's Principal Public Health and Science Advisor, as well as the Secretary's Chief Opioid Policy Advisor. I said we're not going to read bios, but this is the Admiral, and I'm going to read his bio.
You can stop. It's really fine. I'd rather get on, but...
Just very quickly about his office. I'm going to skip half of it. It's really quite a distinguished bio, but I want to give you a sense of his responsibilities. He oversees the Office of the Surgeon General and the U.S. Public Health Commission Corps, as well as key public health and science offices that focus on transforming the current sick care system into a health-promoting system. And I'm going to please read his bio. I'm going to skip the rest. And please, ladies and gentlemen, welcome Admiral Brett Giroir.